Good morning.
Morning.
For those of you who don't know me, my name is Graham Turner and I'm a sixth former. On March 13th, 1997, in Redwood Shores, California, I was born with a condition called meconium aspiration syndrome. Subsequently, I was born in complete respiratory failure. The doctors at Lucile Packard Children's Hospital informed my parents of the situation at hand. They said I had about a 10% chance of survival, and if by some miracle I did survive, there was high potential for deafness and brain damage. However, for the next month and a half, with the help of an unbelievable team of doctors, a specialized lung and heart bypass machine called ECMO, the care and love of my parents, and an innate sense of determination, I fought and defied the odds. I survived. One would hope, and most felt, that I had fought and won the battle of a lifetime. However, as I have learned, adversity does not limit itself to one point in our lives. In the fall of 2011, I was excited to begin my freshman year at Salisbury. I was looking forward to living in a dorm, having a roommate, and being independent. That is how my year began too. But before long, I started to experience digestive problems, which led to vomiting, loose stool, abdominal pain, and blood loss. My subsequent weight and blood loss led to extreme fatigue, which persisted for weeks. Between trips to the bathroom, I would lie awake at night, scared to death I had cancer or some other life-threatening disease. After a while, I stopped looking in the toilet because the sight of so much blood convinced me I was going to die. By late October, it was clear that whatever I had was not going away, so my doctor scheduled a colonoscopy. Until that point, I believed a colonoscopy was a procedure for only men my dad's age. So, while my friends were leaving for the holidays, I was home drinking disgusting white liquid and voiding my bowels for 2 days in preparation for the procedure. On Christmas Eve, while most people I knew were getting ready to open presents, I got the gift that keeps on giving, a diagnosis of ulcerative colitis, an inflammatory bowel disease affecting the large intestine for which there is no cure, only the hope of remission. There are also a few medications that can help control the symptoms. Some of these medications are advertised in 2-minute TV spots where the first 15 seconds highlight the wonders of the drug and the next minute and 45 talk about how the side effects might kill you. Of course, if the drugs do not work, there is always this surgical option, removal of part or all of the large intestine. The most terrifying time for me, however, came in the spring of my freshman year, when I was speaking with my doctor. After updating him on how I was feeling, he told me that patients with ulcerative colitis are at a highly elevated risk for developing colon cancer. I've been through more in that year than I had in my entire life, maybe excluding the first month I was alive. But when the word cancer entered the conversation, the severity of my disease became much more real. During my sophomore year, I had to miss school once a month to spend the day in the Connecticut Children's Hospital, where I received infusions of a drug called Remicade. Despite some of its side effects, the drug worked really well for me. Then, just as my luck began to turn, I developed a severe allergic reaction and had to switch medications. The new medication, Humira, is administered with an auto-injector, similar to an EpiPen, that injects an anti-inflammatory medicine into the bloodstream. The injection is very painful, and unfortunately does not work as well for me as Remicade did, but it's better than nothing. One of the hardest parts of having a disease like ulcerative colitis is learning how to deal with the symptoms and their effects on your day-to-day life. Things that most people don't think twice about, like taking a walk or going on a trip, for me require special planning. There's a reason I can't travel with my lacrosse team. There's a reason I sometimes have to get up and miss class. There's a reason I can't practice some days. This is all hard to understand for someone who's not dealing with these challenges. I know I would have a problem understanding. But you never know what the person next to you is battling, what they're fighting, or what they're going through. More often than not, that person is probably perfectly okay. But it's important to treat people well and with respect, because there may be that one person that's fighting something far worse than any of us can imagine. Treating people well, with kindness and empathy, can sometimes make all the difference in the world. I struggled academically my freshman and sophomore years, largely as a result of my disease, but also because of a lack of work ethic. I struggled with who I was and where I belonged. I did not feel well physically, of course, but I also didn't feel I was good at anything. I hadn't accomplished anything. I had nothing to be proud of. I was just floating. As a result of my poor grades, I was afraid I would not be able to return to Salisbury for my junior and senior years. Two things happened that turned me around. First, I was able to come back to Salisbury for my remaining 2 years. And second, I took an intensive filmmaking course at Fairfield University during the summer after my sophomore year. I found something that I was good at and was very passionate about. With a lot of hard work, my junior year was a leap for me, academically and socially. My grades were significantly better than they have been in the past, which I think changed many faculty members' opinions of me. I was elected into a number of leadership positions and became more involved around campus. I was able to use my passion for filmmaking to make a documentary on last year's varsity hockey team, who went on to win the New England Championship for the second consecutive season. Creating something that is widely appreciated by your peers was an experience like no other. I am proud of the direction I've taken the last 2 years, and I really, truly feel I've turned myself around. I've had unbelievable help and guidance here at Salisbury, and I'll be truly sad to leave in a couple of weeks. I've learned unbelievable lessons, grown an incredible amount, and made some of my closest friends. There's a piece of artwork above my dad's desk. The image is an x-ray of me when I was a baby during the surgical procedure that placed me on ECMO. The only visible objects in the picture are my bones and the hardware that had been inserted into my body to keep me alive. Written on top of the artwork is a letter, which reads, March 14th, 1997, 12:30 p.m., 17 hours old. Dear son, when I arrived at the NICU, the nurses asked if I had a Polaroid camera. I should be sure to take some pictures, they said. They asked if your mother and I had given you a name. Not yet, I replied. Perhaps they thought this is all we would have to remember you by. There's a second picture on my dad's desk. One of my dad and I, taken last May at my sister's closing ceremony. We were standing, smiling, shoulder to shoulder, both healthy and strong. When I think of my story, I think of those two pictures, directly adjacent from one another, and how far I've come in between. In closing, I would like to say this. Adversity is a test of character. All of us, at some point, will battle adversity. How we respond defines who we are. Thank you.